If you have rheumatoid arthritis or any kind of joint pain, someone has probably told you to stop eating certain foods like nightshades, tomatoes, potatoes, peppers, eggplant, even paprika. Cut them all out. I'm Dr. Neha, and I treat autoimmune disease every single day. And when I looked at what the research actually says, the answer is surprising. One study found people who ate the most cooked vegetables had about 60% lower odds of rheumatoid arthritis. Stay with me, because at the end of this video, I'm going to show you what I actually cook with these foods at home. And yes, there's a difference between raw and cooked. There's a lot of little nuances here. This here is a traditional Indian dish that is almost always in my grandmother's kitchen. It has all of the nightshades, tomatoes, potato, eggplant, all cooked together. At least once a week, it's important for her that she have it. And feed it to the rest of us. So yes, we're going to talk about nightshades in this video, but there's a second question underneath that most people never ask. And that's, does it matter how exactly you cook them? So let's back up and get started. The claim is that these foods contain a compound called solanine, and that solanine triggers inflammation, which could be causing the joint pain and maybe a flare. I had a patient come in recently with a grocery list of everything that she had cut out in her diet, including all of these nightshade vegetables. She hadn't eaten pasta sauce in a year. I was her second opinion rheumatologist, and she had been having a lot of flares, and she asked me, is my diet actually making a difference over here? This poor woman was miserable from all the things that were hard to do on a daily basis, eat out with her friends, always have certain foods around. And that's why I think it's so important to know what's the actual evidence. Because the recommendation to eliminate all nightshades is not coming from rheumatologists. It's coming from wellness blogs, influencers, books written by people who may have an autoimmune disease and they found things that worked for them, but they're not necessarily treating an autoimmune disease. And when my patients ask me about it, I think it's really important to know what we actually have data for. So here's where it gets interesting. There's no actual published, large randomized clinical trial that shows us that cutting out nightshade vegetables with rheumatoid arthritis is going to reduce flares. There's little tiny trials, but zero of these large RCTs that anybody who knows me knows I love to talk about. And in a minute, let's talk about how cooking these foods could make a difference in this whole conversation. Maybe not completely, but certainly some things. Now, does this mean that nightshades are completely harmless for everybody? Not exactly. A 2025 scoping review by researcher Julianne McNeil looked at elimination-reintroduction diets across dozens of studies in RA patients. Potatoes and tomatoes did show sensitivity for some, though foods like wheat, corn, dairy, eggs, beef, and pork came up more often. And this goes along with what we know. Food sensitivity is a thing. And here's something most YouTube videos won't tell you. There's a registered clinical trial currently going on studying nightshade elimination in rheumatoid arthritis. It's a study out of Iran, and they had filed for it in 2023, and then in 2024, I believe they did the study, but we're still waiting for results. And it's been a couple of years now. So that already tells you it's not a simple question with a simple answer. There is another study called the ITIS study, and it was a really cool diet because it was a Mediterranean-style diet, but they said you had to have green tea every day, you had to have a green smoothie every day, they cut out gluten, they cut out dairy, except for yogurt, they cut out alcohol also. So there was a little bit different, and they did cut out nightshade vegetables. And this is the one study that gave me pause, because people who were in the ITIS study, they felt better. Their rheumatoid arthritis was maybe not as severe, and their fatigue really improved. Activity scores improved on the ITIS diet. So doesn't that prove that nightshades are the issue? Not so fast. Because ITIS did not just remove the nightshades, it removed so many different things. The gluten, the processed food, alcohol, red meat, and most dairy, and then said you had to have the green juice, the green tea. So it was a little bit of a different type of diet also, not just nightshade vegetables. So we're not really sure what helped, and we don't have an exact clean answer yet. Because you have to isolate just one ingredient, only one variable, to really see if it helps or doesn't. And this study didn't do that. Okay, here's the part I promised you, because it turns out the more interesting question isn't whether you eat nightshades, it's how you prepare them. And this is where the research is a little more specific. There's a study out of Athens, Greece, people with rheumatoid arthritis, and compared them to healthy controls over 2 years. So it's a pretty long study. And this is an older study, but here's the finding that stopped me. The people who ate the most cooked vegetables were about 75% less likely to have RA than people who ate the fewest. Raw vegetable intake did not show the same protective link. It was cooked vegetables. And having a lot of olive oil was also related to lower RA risk. So this study, even though it was a long time ago, it's actually one of the only studies that looked at the cooking method and the RA risk together. And it's some of the closest evidence that we have that preparation might matter more than the actual ingredient list. But to be really honest, not everything about cooking nightshades is proven in the way that people think it is. A lot of people say, okay, you can eat nightshades, but just cook them and that'll take away the solanine. That's not exactly true. Solanine is heat stable, so it doesn't just disappear. Could it be reduced when you cook? Maybe, but it doesn't just go away. Regular cooking, boiling, sautéing doesn't really break it down much. So if solanine is really your concern, cooking is not the fix that people assume it is. Tomatoes, though, are a different story. Cooked tomatoes were associated with lower inflammation markers, which we always want when it comes to rheumatoid arthritis. It was a little bit of a reduction, so I'm not going to oversell it, but it was a signal. And what's really neat is that lycopene, which is an anti-inflammatory compound, it becomes even more available to you if you cook the tomatoes, especially with a bit of olive oil. In one study, the plasma lycopene, so blood levels of it, went up almost 80% in people who ate tomatoes cooked with olive oil versus almost no change when you didn't use the oil. So cook your tomatoes and don't skip the olive oil. Here's the twist. Cooking isn't always better. Broccoli, on the other hand, it's the opposite. One study found that lightly steamed broccoli, about 2 minutes, had almost 3 times as much sulforaphane as if you boiled it. Because if you boil it too long, you lose most of the benefit. Garlic is a similar story. Crushing garlic and letting it sit for about 10 minutes before you start cooking with it is also reasonable. There were some studies that suggested that may be more helpful for getting the nutrient compounds out of it. Not a guarantee, but it's an easy thing to build into how you cook. So here's where this leaves us. There is no proof that avoiding nightshades helps RA, but how you cook the foods that you already eat may genuinely matter. Cooked vegetables with olive oil, lightly steamed broccoli, garlic, given a few minutes before it hits the pan. These are small details with some real potential benefits. But what has the strongest evidence of any single food or kitchen hack, it's the overall pattern, the Mediterranean-style eating pattern, done consistently. Let me tell you what I see in clinic as a practicing rheumatologist, because you have to look at what's in front of you. I had a woman who was 62 years old. She'd been avoiding tomatoes for 2 years. For 2 years. Her daughter told me that they were causing her flares. And I checked her labs, and I actually had labs from 2 years ago that she had sent me, and they were really no different. Her functional doctor had been checking all these vitamins, and she found out that she was really low in vitamin C. And she's not the only one that this happened to. It's when you avoid an entire class of foods, you may be losing some really rich nutrient compounds. So patients who have eliminated these nightshade vegetables for 6 months or longer could be running into some nutrient issues. And the more important thing is that when I've asked people if they feel better, because that's really the reason, right, that you would do that, most of the time I hear that initially they thought it helped, and it could also have been that they're now eating better foods and cutting out the garbage, but that now after a couple of years it really wasn't as effective as it used to be. Tomatoes are one of the richest sources of lycopene, an antioxidant with anti-inflammatory properties. Bell peppers are packed with vitamin C. Potatoes are a good source of potassium. So when you eliminate an entire food group based on a theory that hasn't been proven, you might actually be making your overall condition worse. Now here's the nuance, and this is important, because if every time you eat tomatoes, you get a pain in your joints or you don't feel well after 24 to 48 hours, you need to stop that food, because individual food sensitivity is real. But that's not the same as saying that you're allergic to an entire class of foods and that they're bad for all people with arthritis. Those are two completely different claims. So I tell my patients, don't eliminate blindly. If you suspect a specific food is bothering you, then try a structured elimination and reintroduction diet with your dietitian. I do believe all my patients deserve a dietitian, but not always easy to get. So if you can't get one, then I would suggest having a food journal and trying it one ingredient at a time, like either peppers or potatoes or eggplant. Just change one variable in your diet for a few weeks and see if that makes a difference. And I said I would show you a recipe that my family loves. It does have tomatoes in it. These are actually blistered tomatoes with farro, with some greens in there, a squeeze of lemon to get that vitamin C, and a sprinkle of cheese, which my kids love. This is the kind of meal that fits an anti-inflammatory dietary pattern. It's whole food, plant forward, rich in antioxidants, and yes, it has nightshades in it. Because the evidence that we have supports eating a variety of colorful, nutrient-dense foods, not eliminating them out of fear. So the best diet for rheumatoid arthritis isn't about what you're removing, it's what you're adding to it. The plant-rich foods, the fiber, the consistency behind that. And now we're learning more about even preparation. How you prepare those foods makes a difference. More vegetables, more variety, more color on your plate, cooked the right way. That's what the research is so far supporting. So to recap, there's no clinical evidence right now that says all nightshade vegetables should be removed from people who have RA because they cause joint pain or flares. You could have an individual sensitivity, and I definitely think that's worth looking into. And if you find something that you're sensitive to, like let's say tomatoes or peppers, see if it makes a difference whether you cook them and for how long. It's easy to just cut out something, but it may be that in the future you're going to be like, why? Why did I cut it out? It's good to actually study it for yourself. Small details, but very helpful for you. So if you found this helpful, save this video so you can come back to it later when someone tells you to stop eating tomatoes. And is there a food that really bothers you with your arthritis? I'd love to know. If you do know somebody who has cut out this entire group of foods or is planning to, please share this video with them. I'm Dr. Neha with Plant Forward MD. I'll see you next time.